Dementia not only affects the memory, but can affect all of the senses. Vision can narrow as the brain is able to cope with less information from its environment. Sense of touch can change, making it much harder to feel and use objects. People with dementia can also become hypersensitive to noise and have difficulty filtering out sounds, as well as experiencing auditory hallucinations.
Okay. What are they looking for? So it's pretty interesting.
For example, at mealtimes, using a different coloured plate to make sure it stands out from the background. Using adapted cutlery to help with coordination, and drinking aids like non-spill cups. We tried to recreate how it can feel for our patients by impairing OT staff senses and asking them to perform simple tasks.
Yeah, I found it really disorientating, really anxiety provoking. I felt quite panicky. I couldn't feel my fingertips, I couldn't grip properly. The noise in my ears meant that I couldn't kind of respond to, the clinking of the crockery, and my eyesight was so restricted, so I couldn't see, I couldn't feel the towels. I felt like I wanted to do it quicker, and yeah, I just felt quite fearful really that I was going to make a mistake or I was going to break something.
When working with patients with dementia, we need to adapt our approach to help them live with these new changes. We can still provide lots of positive sensory experiences by using sensory stimulation activities and adapting how we interact with patients. For example, making sure we slowly enter their field of vision so we don't just appear out of nowhere. Using a mixture of familiar and unfamiliar sensory objects that stimulate different senses. Making sure to avoid overstimulation by not stimulating too many senses at once. With the right support, people living with dementia can still live a meaningful life.